Braving the cold, those that are here and those that are out there in Wonderland. Good. Thanks for joining. I'm going to just go down the roster, and that way we'll make sure. So if you would respond, Mike Brower, Sarah, can you? Robin?
Here.
Sandra?
Here.
Gary?
Here.
Jason?
Here.
Let's see, Mike Kage's not here. Ken Gregoire's not. Monica? Okay. And Keith? Here. How many we got with we got a couple that we're waiting on. 8. Okay. So we're good to go. Have a lot to cover today, but we do have a presentation that will be interesting in that it'll be kind of wading in, or we'll be talking about collaboration and that with our group today and what they're looking to do. So the first item of business is the approval of the January board meeting minutes. So those were sent out, and I would entertain a motion for approval.
This is Mike. I move to approve the minutes as written.
Motion, do we have a second?
This is Sandra, I'll second.
Second, any discussion? Seeing none, all in favor? Aye.
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 Opposed, same sign. All right, thank you. Let's see, is Chris, he's on WebEx, so we'll move right into Chris's report. Any updates, Chris, or any other business? I think we do have one item to consider.
Yes, there's one action item. Thank you, Mr. Chair. So yes, a couple quick updates for you before we get to that action item. First, you probably saw in the news an update about the Purdue Pharma case. I did want to let you know that I can confirm that there is progress on that. I cannot give you any additional details at this time, but we are making progress on the Purdue Pharma case, so there is good news there. Second, we are making progress on getting municipal annual reports. We are pulling things together on that. Thank you to Nancy for the incredible work on getting that project completed, ready to do a report on how 2024 receipts and spending went for the municipalities. What I can tell you is from what I have seen, it does appear that utilization is up in 2024. More subdivisions seem to be using their dollars, but I think there's still a lot of room for growth and a lot of room for additional education. Moving then on to one other item that I just wanted the board to be aware of. If you have not seen, there is a bill dealing with naloxone grants for law enforcement. It is HB 2159. I would tell you to just keep an eye on that. It may inform our decisions on future naloxone funding. And the need for future naloxone funding. So just be aware that that bill is out there, as it does not use, as far as I'm aware, it does not use any of the Kansas Fights Addiction dollars as an attempt to use those dollars, but it would be supplemental to other funding sources, other opportunities for naloxone. Before I move on to the action item, does anybody have any questions on those updates?
I don't know if this is for you, Chris, or Krista, but seems like a year ago we were talking about, when we were looking at the naloxone, that there was different pricing going on all around the state. And did we encourage, like when Central Repository, did that ever happen? Or
Yeah. Oh, Krista, go ahead.
Sure, yeah, we recommended to the KFA grantees to collaborate with the statewide program at DECA because they can get a reduced price rate. I don't think that that is as difficult, I guess, for purchasing of entities now since it's over the counter. So a lot of the pricing has gone down in general. So I don't think it's as much of an issue as it was prior. But yes, that's still a resource that is out there that they could use.
Yeah, as far as we're aware, prices are falling on naloxone and distributions are up through the state naloxone program. One additional update I can give you is that first delivery of naloxone through the Teva settlement has made its way, should have made its way to the state naloxone program this month. I believe that delivery is completed, so that was 9,000 kits, and we'll anticipate 9,000 kits a year going forward. So we're making pretty solid progress on hitting what would be considered minimum saturation thresholds. I think we should hit that minimum saturation threshold of like about 58,000 kits a year. I think we should hit that this year based on information I've been provided. I will not confirm or guarantee that we will, but it looks like that we should be pretty close. Any other questions on these particular items before I get to the action item?
Other questions? Seeing
So
none,
then-
go right ahead.
On the action item, as you all are probably aware, we are putting on a conference, one-day conference for municipalities to do education on how to utilize the dollars, best practices, collaboration efforts, things like that. That conference is going to be April 18th, I believe is the date, in Overland Park. So one of the things that we're doing is this is in collaboration with Sunflower and the Opioid Response Network. But since it's an all-day conference, we would like to be able to put on food so people don't feel the need to go fleeing from the conference every couple hours to go get food, coffee, those sorts of things. And unfortunately, the Opioid Response Network cannot provide money for food. They are providing money for basically everything else, but they cannot provide money for food. So the AG's office would like to request a grant from the board to cover food for municipalities. So this would be a light breakfast, lunch, light snacks in the afternoon. For roughly 70 people that we anticipate will be there. And the total amount for that would be that we anticipate is roughly $4,300. I'm pulling up the exact dollar amount real quick. But this would be to ensure that folks are able to actually stay at the meeting and actually stay engaged. And pull as much information as possible. What I'd actually like to request is a little bit over the amount that we would need, just in case there is some balance that we have to pay at the back end. So my request would be for the board to approve $5,000 for us to purchase food for the municipalities conference on utilization of the opioids dollars.
Thank you. Any questions of Chris? Otherwise, would look for a motion to approve that request.
Chair George, this is Sarah Kaler. If there are no questions, I will make a move to approve that request up to $5,000.
Sarah moves. Do we hear a second?
This
I'll
is Robin.
second.
I'll second.
Any further questions? Seeing none, all in favor, aye.
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 Those opposed, same sign. All right, that's a good request. And do we have a date locked in for that? Did you mention the date?
Yeah, it's going to be April 18th in Overland Park, and there should be. We are working to deploy a remote option so that folks can remote in and watch. Hopefully, be able to record, but we're still finalizing those details, so I won't confirm that option will be available until we know for certain that the technology will be available to do it.
Great, thank you. Krista, any updates on our grants, needs assessment, et cetera?
Yeah, so Alyssa's out today for the needs assessment, but That is progressing as expected, and we anticipate it wrapping up at the end of March, and then for the board to receive the presentation of the needs assessment results in April, so that's still moving forward. We're still working on the public comment plans and moving that out via multiple mechanisms, so more to come on that for needs assessment. For grant updates, we have initiated all excuse me, of the initial grant documents and paperwork for RFP 3 and RFP 4 awardees, so that's in progress. For RFP 1, we have 16 that are officially closed and have had their final payments, and then we have 9 that are officially closed under RFP 2. And we have just about $433,000 remaining in payments from those, the rest of those grants that are still outstanding and wrapping up. Several, of course, requested extensions due to inability to spend the dollars by the end date, and so we had flexibility there. But we have 16 from 1 and 9 from RFP 2 that are completely closed. So those are the updates on grants. If we have any questions.
Questions for Krista? Thanks for that information. The next item is the outreach to the legislature, and I guess I'll jump in here first. We appeared before the Appropriations Committee in the Senate Ways and Means here maybe 3 weeks ago or something like that, and both committees went well. The meetings were well received, had some questions, and then we followed up with some answers to the committees. But in general, I can't remember anything specifically that, that was out of the ordinary as far as questions. Afterwards, I ran into several legislators, and they appreciated, us giving the presentation. We had Kristen, Brandon, Alyssa, myself, and was that Shannon? Yeah. We had all our bases covered, and so I thought it went pretty well. I don't know, Krista, Brandon, any further comments? And then again, encourage you, if you're your hometown or your in-district legislators, senators, House members, if they're doing a coffee or going somewhere. In fact, this weekend would be their turnaround, which is kind of like their intermission in the middle of their session, so they'd all be at home, probably making the rounds. So if you get a chance just to say something to them, see if they have any questions, if you happen to come across them. That's, having been in that role, it was always welcome. It wasn't like it was a pain in the behind when somebody came up. It was good information to know. All right. Moving right along, I know some people have been heavy duty at work. You can tell by the product that a lot of time has gone in, and so we need to approve this, hopefully, the annual report, because we present it to the governor's office and to the legislative leaders, and there's a whole list of people that get the report. And then I assume it's online. Is that right? So it's for anybody in the legislature or anybody actually in the state that has an interest in it. And I just applaud everyone that had a part in putting it together, because it's outstanding, a lot of great information. I don't know how you do it. It'd be way above my pay grade to put something together like that. Thank you for that. Any questions about the annual report? Sandra?
Just to echo that, I know you guys put in a lot of time on this. I mean, that's a big old document. Just a recommendation maybe for next time, an executive summary at the front with the high points, which might encourage people to look farther into the detail, but it is a lot of information to read, and so just kind of going forward, maybe one pager. Here's what this says.
Yeah, that's a great idea. Thanks. We'll do that next year.
Yeah, so
Mr.
I'm
Chair,
just
this is
curious.
Monica. Oh, sorry. Go ahead.
Well, I was just going to say, can you explain your process for completing this and your own internal review process for accuracy
Yeah, sure. So typically for me, I start with the annual report from last year, which I developed in collaboration with Chris the first time around. And of course, the first guiding force is our statute, making sure that we're hitting all of the points that are required by statute. And so I start with that as a base and then put all of the information together. I pull a lot of the grantee data and whatnot from the reports we put together for you all for the review. For the awarded grants, and then we also we change it a little bit because we, by statute, have to require, or we're required to add a description of the organization. And so those summaries look a little bit different than what you guys received during the review and selection of grants, but that's pulled from their applications as well. And then we try to shorten it a little bit because some of them are really long and some of them aren't actually really describing their organizations. So we do a little bit of tweaking there, but mostly it's just coming from the applications. And then our team at Sunflower, we have reviewers there. And then we send it to Chris at the Attorney General's office, and then he gives the okay before the draft comes to you all for that final review.
Thank you. It's real obvious that there's an extensive process, and I just thought it's good to verbalize that for everyone, all the public, and for everyone here. But good job. Obviously, none of us read every word of it.
Mr. Chair, this is Chris. If I may hop in, could you all make certain to turn on your microphones? We're having a little difficulty, I think, hearing y'all.
Okay. Yeah, turn it
Mr.
on
Chair,
and
this is
then-
Monica.
Go ahead, Monica.
Hey, thank you. Good morning, everyone. Krista and I visited yesterday. I just had a couple little questions about the layout on the finances, but and she was able to quickly answer those for me. And I just want to say thank you for doing it. Number one, it's easy to read, even though it's a lot to read. And I can see how parts and pieces of this, once it is approved, I'm going to cut out and share with different parties who may be interested in the information. And then also, I feel like it is just a really nice summary of the thoughts and processes that went in to all of this happening. And so a little bit of a justification to those who say, what the heck have you guys been doing? And so thanks for doing our homework for us, Krista and Chris. It's a really nice document.
I would
Other
just echo what
questions?
Monica said. It really explains what our process has been and our thoughts, I think thoughtfulness about what we've done. So good job, Krista.
Other questions or comments? And some of the questions that the legislative committees brought up, you know, we're able to say that the annual report is coming out soon and we'll have much of the detail that they alluded to there. So it'll be looked at. They get a lot of reports, so they probably won't read every word of it. But the idea of getting some of the highlights, cut and paste, and send them to whomever might be interested, but that report will be available online. So if there's no further questions or comments, okay, Krista?
Just to add really quickly, the last thing before approval we need to add if it's going to be ready in time is the 24 distributions for the MFAF, so the table in Appendix 1. That's still showing 2023, so if we're able to get that table in time, I'll add that in there and update it. If not, I'll remove that appendix and update throughout the document the appendix numbers, because then they'll change. So that's one just final thing that we'll need to change.
And Krista, we should be able to get that to you next week. One final note on this, and this is something we'll have to recall, because I think last year we inadvertently left a labeled draft somewhere on the document when we published it and submitted it. So just one thing to note, we'll just need to make certain we remove the word draft everywhere before we submit it to the legislature or publish it online.
Look for a motion to approve the annual report for distribution.
This is Monica, so moved.
This is Sandra, I'll second.
Any further comments? All in favor, aye.
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 Those opposed, same sign. Well, good. Thank you once again. We're moving right along here. Are all of our speakers joining online?
I believe so. Our KDAD's rep wasn't able to attend, and he was going to try to find someone else. I don't know if, Chris, you heard any update, but the other two for sure were going to be virtual. Chad, or Chris, did you hear anything else from KDAD's?
I did not.
Okay.
I don't know if you can text them, tell them we're running ahead, and then we can move to, there's a couple of things I was going to discuss when we get to item 8. We can discuss those and see if they can join us. Otherwise, we'll take a little break and get back with it. So, so the needs assessment will be ready, and we plan to roll it out in April. And so I've been thinking about the best way. I don't know how many pages. They've been working on it for a year and a half, so I imagine it's pretty extensive and that. So if you have any thought on how it would be best presented, just my own, I was thinking in April that, if we could get the report ahead of our meeting would be nice to leaf through it, obviously, and then at our April meeting would maybe discuss or, have the presentation of at least the high points, and then perhaps we could follow up via WebEx, a couple weeks later and kind of get into more detail. And then if we, I would anticipate over the next 3 or 4 months that we would have people from the assessment team here, if things come up that we have, because to me, it'll be kind of our guiding document as we go forward into the innovative stage. So just wanted to take plenty of time in my old age. My absorption rate, I don't know if that's the right term, but retention maybe is a better, is not like it was. So that's just kind of my thoughts. So I didn't know if anybody else had any thoughts on how we would want it presented. I know they'll be very, accommodating.
I like that plan of action. This is Mike for those online.
Okay. We will kind of let them know for sure, and they probably already know this. It'd be if we can get that ahead of the April meeting sometime that week. I know they'll be putting it together right up to the time, but whatever we can get ahead of time, and then again, kind of an overview per se. I'd rather have an overview and spend several hours at it in April than to have 5 hours in April. I'd rather spread it around, and with technology, it'd be easy to follow up with WebEx however many times we need to do that. So, any other comments? Oh, I have one other thing, and I know the AG's office is looking into this. There's, of course, there's all kinds of conferences all the time, but some people that I'm in touch with at a national level and aware of what we're doing and want to accomplish had recommended a conference that's in the middle of June, and if it's an allowable expense, might see if any of the board members, as well as members of Sunflower, would want to attend it. It's a behavioral health management forum, and really they're looking at doing a lot of things, when we talk about integration and working across the full spectrum, including the physical health part. People that I know and trust recommended this being one of the top ones, for that. So we'll get more detail. We'll make sure that we could cover the expenses to go for it. It's the 16th and 17th of June in Nashville. So as soon as we find out if for sure that's an allowable expense, then they will send out. And I just thought it would be good if several of us, and there might be other ones too that if you come across, but again, a lot of these things will be our guiding light as we go forward to this innovation stage. So.
Who is sponsoring that conference? Never mind, I'm just going to read. I'm just curious if this is the Becker's conference.
I don't know. I just had got that and I looked over it and made a call, and I just thought I'd put it out there for today and get all that. It's actually, now that I think about it, there was 10 different sponsors, and I didn't print that part off. And see, that was the first question that I got. So. Okay, so we were waiting for a couple of our presenters to join, which they had planned on joining at 10, so hopefully we can get them here a little bit earlier. So why don't we just break for 10 or 15 minutes and see if they're on. We will go to intermission. Get your popcorn. Back to order. Item 7, collaborative continuum of care, medical detox expansion. And we have a couple of the presenters, and they have been working on some ways to collaborate in their different entities that they represent. And so we've asked them to present, knowing that that's kind of where we're going. And am interested to see exactly what they're doing, and perhaps there could be some support just to, for their effort in general. But so I know we have Jennifer and Chad available, so I don't know which one wants to go first, but
yeah, I can get started. I am Chad Harmon. I'm the CEO of the Substance Abuse Center of Kansas, and I'll let Jen introduce herself.
Good morning. I'm Jennifer Wilson. I'm the Director of Crisis Services. I know that Joan Tammany was scheduled to be here today, but she had a conflict as presenting to our commissioners talking budget here in Sedgwick County, so you have me today.
good.
Am I able to share my screen to present the slideshow?
Maybe.
See if I can do this.
Can you send it PDF and then we could display it from here?
Yeah, I can do that. What would be the best email address for me to send that to?
Our IT person is going to send you an email so you can reply to her.
Okay. Still waiting on that to come through.
She just sent it.
Okay. All right, and just sent it back.
All right, it looks like it just came through, so we'll get those pulled up.
Cool.
Hey, Chad, you want to give us just a general overview as we get these loaded? And
Yeah, I can do that. I'll kind of start with the first slide and kind of glance over that a little bit. For those of you that don't know the background of the Crisis Center here in Wichita, it started as a complete collaborative project. From the very beginning, it was a combination of 3 community mental health centers, ComCare, Sumner County, and South Central Mental Health. So from the very beginning, this was a collaborative project. With the idea of co-locating as many services in one location as possible, that being crisis services and detox services. We all know when it comes to substance abuse and mental health, you always deal with that chicken or egg question to know which came first. And this was our way to try and overcome that challenge by co-locating as many services as we could. It has a no wrong door entrance. So if somebody doesn't know if it's a substance use disorder issue or a mental health issue, as long as they arrive at the building, they're going to get their services that they need and get put in touch with the people that they need to be put in touch with. We also partnered with hospitals and local law enforcement to make sure that we're addressing their needs as well. A big piece of this project started as a way to get clients away from using high cost centers to access their crisis services. We all know the emergency room probably isn't the best place for somebody to access these services. And it's also probably the most expensive place for them to access these services. So we wanted to create a more cost-effective, proper place for them to go into. As far as our current services, for detox right now, we have 8 sobering beds, which are designed kind of as a place for somebody to just sleep off a drunk or a high experience. They're there for 23 hours at the most. We have 15 social detoxes beds as well, and it's all housed within ComCare's Crisis Center. And I'll let Jen kind of explain the services that the Crisis Center does have.
So currently in the Community Crisis Center, in which we share a location with the Substance Abuse Center of Kansas, we have a crisis observation unit that has 6 recliners. We're looking to expand that to 8 recliners, which is a 23-hour observation. But within another building, which we plan to make into one in 2026, we have the Crisis Stabilization Unit, which is an alternative to psychiatric hospitalization. And over there, we have 10 beds of stabilization and transitional housing beds. So the idea is to be able to provide people stabilization while still able to access outpatient services and maintain connection to their providers, with the hopes to reduce the likelihood of a crisis in the future. We do contract with the Wichita Children's Home to provide stabilization for youth. We just don't do it within our center just because of the population we serve here and it needing to be a licensed bed. So the Children's Home, since they do have licensed residential beds for youth, we just contract and have one, at least one available for youth who are in need of those stabilization services. We have a variety of other services that we offer through the Community Crisis Center, including mobile crisis response, some co-responder type work that we do with law enforcement, is liaison services with hospitals, field-based case management for high utilizers of emergency services like first responders, 911 services, or the emergency room. And then just the walk-in 24/7 screening and our 988 hotline. So it's really that crisis stabilization 24/7 center, and we appreciate Substance Abuse Center of Kansas being there to be able to refer to detox and provide some assessment services for psychiatric care while they're there.
As far as services we've provided in calendar year 2024, our detox unit admitted 608 individuals to our unit, and that's just in detox. That doesn't include sobering. Those admissions came from 20 counties throughout the state of Kansas. So about 11% of our admissions were from outside the Sedgwick County area. I will put a little bit of a caveat on that because of Sedgwick County being kind of a hub for a lot of different services. A lot of them will report they're homeless, but could be from other areas of the state and for some reason or another found themselves homeless in Sedgwick County. Then Jen, do you have the numbers for ComCare?
As far as the continuum of stabilization services, we had 696 admissions, and that's the Wichita Children's Home Stabilization and Observation Unit combined. We looked at the addresses of patients that we served, and out of county patients had addresses. 224 patients that we served had said that they had lived outside of Sedgwick County. Again, kind of highlighting the no wrong door approach. No matter where you live, if you come to our center to access stabilization services, we're going to serve you.
As Jen alluded to for the future services, ComCare and Sedgwick County are working on creating a new crisis center that's scheduled to open sometime in 2026. A big piece of this is going to be more centralization of all of the crisis services. Jen, if you want to speak to the CIC services that we're talking about offering as well.
Yeah. So we're going to expand on the current services that we have, increasing observation to 8 beds, but then also really focusing on the stabilization component, offering an alternative to state hospitalization. So rather than looking at transitional housing, we're hoping to have become a licensed crisis intervention center, which really is that alternative to Osawatomie State Hospital, Lawrence State Hospital, and being able to provide both voluntary and involuntary care within that center.
In addition to that, we're wanting to expand our services that we're offering for detox. We're going to increase from 8 to 10 sobering beds, and then increase from 15 social detox beds to 26 detox beds that can hopefully be medical in addition to social. As far as the need is concerned, in 2024, we had 24 clients that had to be sent by ambulance to the hospital due to withdrawal symptoms requiring medical attention. So that included things like having seizures, their blood pressure was too high and we couldn't manage it under our settings, things of that nature. ComCare had 74 clients that had to be referred for acute medical care as well. We had 12 individuals walk out of detox altogether due to not being able to receive medical assistance while detoxing. Over 1,000 phone calls come to SAC a day or a year requesting medical detox services. Since we can't offer those to uninsured individuals at this point in time, that would leave you to perceive that a good portion of those don't even seek detox services and don't even seek any type of treatment services. And then 10% of the non-admits to our detox center were due to them having BACs above 0.3, which seems pretty high, but with our clientele, 0.3 is, it's not unusual for me to be sitting there having a conversation with somebody blowing around a 0.4, but having the medical staff there would allow us to take more of those patients in. As far as our budget, we're looking at around 1.64 million to be able to add medical detox to our services that we're able to offer. The majority of that is in staffing cost. It requires 24/7 nursing and a medical director that's available to be on call. So most of our cost would be towards the nursing and the medical. Our current funding, currently the city of Wichita is giving $150,000 in city liquor drink tax to the social detox model. In addition, KDADS funds $500,000 as a pass-through through ComCare to offset our costs. And then SAC also bills about $242,000 a year in towards our block grant. The other thing that we're really appreciative is that Sedgwick County and ComCare don't charge SAC rent or utilities to locate within that building, which truly keeps our costs down. So what we're needing at this point in time, we're about $752,000 short of the actual goal that we're needing to be able to provide this service. We're looking for assistance to get started. We've reached out to KFA, KDADS, and Wichita Sedgwick County for their opioid settlement funds as well. And based off of a news release I just saw this week, I don't have a lot of answers to it. They are donating or designating a fairly significant amount of the local dollars to this project as well. I know sustainability is always a big question when it comes to grant funding. So we're looking at some different things. Currently, Medicaid does not pay for social detox services. So we had 108 clients admit to the detox unit in 2024 that we were not able to bill Medicaid for because they don't cover the service. So that actually counts against our block grant. So if we're able to do medical, we'll be able to bill Medicaid and be reimbursed by Medicaid for that service at a higher rate. Historically, SAC has never worked with commercial insurance. In 2024, we had 81 admissions with private insurance that we just basically had to eat the cost. We are in the process of paneling with commercial insurance to be able to serve those as well and be reimbursed for those services. That too would also offset our costs moving into the future. Some other funding and cost savings. We're working to collaborate with the hospital to defer and transfer as many clients as we possibly can to our detox center, and which would then free up hospital beds for those that critically need them. That would include Via Christi Ascension system, which covers easily 29 counties. I believe, Robin, you can probably correct me on the actual number, but that would expand our reach as well. Work with law enforcement to defer more clients to the detox rather than taking them to the emergency room or to the jail. And then continue our work with our advisory board. The advisory board that I mentioned that includes South Central Mental Health and Sumner County Mental Health is still in existence, and it serves as in an advisory position for the Community Crisis Center. That's kind of it in the project in a nutshell. I am happy to answer any questions you guys may have.
Thank you, Chad and Jennifer. Questions or comments?
Hey, Chad, this is Sandra Dixon. Good to see your face up on the screen. Can you all talk a little bit more about how you're defining medical detox? One interpretation of medical detox is folks who are at acute risk medically that need to be in the hospital from alcohol use or opioid use or benzo use. But the crisis center is not going to be licensed as a hospital. So can you define a little bit more about how you all are interpreting the phrase medical detox?
Right. It's probably the more accurate term would be acute detox. What we would be able to do is offer medication to assist with the withdrawal process. If it's an opioid that they're withdrawing from, we would be able to prescribe or get them on Zofran or something like that to help with the nausea, vomiting, which seems to be a big thing for opioid users when they're coming down. My medical director that I will be hiring is working to determine how much he can give something like Ativan to help reduce the risk of seizure for somebody withdrawing from alcohol. There's still going to be those individuals that will need to go to the hospital for obvious reasons. But the idea would be that it would be the kind of that in between that doesn't necessarily need hospitalization and can safely detox with medical supervision. The other thing that we would be able to do is have nurses monitoring vitals and to make that determination as well.
Thanks, that's really helpful.
Other questions or comments?
Yeah, so you're without medical detox, you said that your budget is already short $745,000.
No, we're short $750,000 to be able to do medical detox. We're operating in the black with our current model right now, or as close to black as you can doing this service. So.
Okay, all right, thank you.
Other questions or comments?
One other, so are you doing Suboxone within the Crisis Stabilization Center?
We can't at this point in time since we're not licensed as a acute or medical detox center, but the plan would be to be able to do the Suboxone inductions while they are in our unit and then be able to refer them to ComCare or other MAT providers to continue that service once they have left the facility.
And I know that Joan had specifically said that being able to do detox within the community crisis center could help make that connection with the ComCare provider. And there's actually been good outcomes with MAT here. She was talking about how our psychiatrist was bragging on how people have gained employment and have really been able to maintain success through that treatment approach here. It's just extraordinary to be able to see people make those kinds of changes in their lives.
In talking with our clients, one of the difficulties with Suboxone is you have to be pretty much withdrawn from the opioid before they start it. And it's difficult to get a client to that point. just because of the discomfort they experience while they're going through opioid withdrawal. And by being able to manage that a little better and make them more comfortable, the chances of them actually making it to the point we can induce them on Suboxone is going to increase exponentially.
This is Sandra again. So have you all talked to the folks in Douglas County? Because this is sort of what's happening at the Treatment and Recovery Center now with their psychiatrists and APRNs, kind of managing that in between. They don't have to be at LMH because they're not so acutely ill that it's life-threatening, but it's beyond sobering social detox, and they are doing some prescribing. So I'm just curious if you all have talked with them about how they're navigating all of this, because it hasn't been easy for them.
Yeah, no, I just learned recently in talking to some of my partners up in that area that LMH and Douglas County is working on this. And that's a conversation piece that I'm trying to reach out and start seeing how they can do that, getting my medical director in touch with them so that we aren't reinventing the wheel if we don't have to.
Let me know if I can help you with that.
Definitely. You'll probably be getting an email from me later today.
It's been a while. I look forward to that.
Yes.
Any other questions or comments? So I had a question. So I'm socially detoxed there, then you look, the next step you're looking for perhaps treatment or housing for the client?
Mm-hmm. Yeah, while they're in detox, we start discharge planning the second they come in the door. We're going to get them that drug and alcohol evaluation to determine if they need treatment, and then start the process of getting, if it's inpatient, that bed reserved for them. If it's outpatient, they'll leave with that referral. If they are put on an outpatient wait or an inpatient wait list, they're referred to outpatient treatment in the interim and assigned peer mentoring and care coordination to help them get to that bed and help keep them as stable and as in contact with us as we possibly can. I also have care coordinators that specialize in housing, that if housing is kind of the route they want to take, we're going to help get them on any type of voucher program we can get them on. We'll do the VSPDAT, which is the homelessness assessment, to try and get them on that list as quickly as we can. So it's not just you're done detoxing, good luck. Hope we don't see you again. It's trying to get them in touch with as many services as we possibly can while they're in that one place.
I know alcoholics and addicts are hard to track. So I don't know even how to ask, some kind of a percent of success, or those that have completed social detox that went on to treatment. And as Jennifer pointed out, the joy of seeing somebody that actually changes their whole life around. So I don't know if it's almost an impossibility to track that, but if you have any of that information, I'd be curious. You can send it to me.
You're right. That is a very hard number to track, especially with the population that frequents the detox unit and the crisis center. We tend to take more of a harm reduction approach to success with a lot of these clients. One of my favorite stories is a guy we were working with that admitted to the emergency department 55 times in 1 year. So more than once a week. A lot of times it was because he was drunk and wanted a place to stay, or was suicidal and things of that nature. After the detox opened and we started working with him, he only admitted 5 times the next year. And 2 of those were because he had strokes. So those were very appropriate admissions to the emergency room at that point in time. So we view that as a success, not only for him, his quality of life greatly improved, but the amount of savings to the community and resources as well was massive.
It is hard to see after stabilization, the success that people have after the fact. I do have my dad was recovering from alcoholism, and he recently passed away, but I went and accepted his 14-year sobriety pin coin the other day, and they celebrate anniversaries once a month, and somebody was celebrating a year, and they said their day one started at SAC detox, And I just don't hear those stories, and the power of just seeing him being able to achieve that year. I was thankful and grateful that I was able to go and see that and see our work behind the scenes, I guess, a year later.
Yeah, very cool. Any questions, comments? Thank you for your presentation, and this is what piqued my interest and it was brought to my attention is the collaboration between the different entities, and sounds like Sandra has similar experience there in the Douglas County area. Definitely will be something that we want to encourage, and perhaps this is a little out of our model that we've operated up to this point, but I look for us to kind of think outside of the box going forward. So not prepared for this at this meeting, but perhaps in the next meeting, if this is the type of project that we want to encourage and fund, that we might take a look at it. But I wanted just to get something out there for to set the tone of where we're going in the future, and even more collaboration. It's been my experience that it's not just substance use disorder or mental health, but there's so many opportunities to collaborate, and I don't think there's a resistance from, I just don't want to work with you. It's more, just don't know how. And I know Ed O'Malley has talked about, some of the same things in the physical health and, the entity that he's CEO of. And so perhaps that could be, that's our legacy, but it's certainly something that we will, put forth as a high priority going forward. And so,
Pat, this is Robin. Can I just make a comment?
Yeah, you bet.
You probably all have heard a little bit about the multi-agency center, homeless 365, 24/7 homeless shelter that is being worked on in Wichita. The shelter opened in November. The multi-agency piece where we bring many community agencies into one space. That construction will begin in April and will take most of the rest of this year to complete. But both SAC and ComCare are integral partners in that work. So I just hope that at some point the KFA board, we can consider working with these two entities, because this multi-agency center is an enormous collaborative effort among probably 40 plus agencies in Wichita, including both city and county government, and then all the organizations within Sedgwick County and the city of Wichita. So it's a true collaborative effort.
Yeah, and, I forget the percentage, like 11% came from outside of Sedgwick County, and I assume when you get the center up and running, there would be even more opportunity to help other rural.
Chad mentioned the number of, I retired a year and a half ago, and the last year I was at St. Joe, we served 78 Kansas counties. So we basically cover the Colorado line to about Emporia. All of the patients seeking care for mental health or substance abuse from those counties come to St. Joe, and so many of them, because they need ongoing services that they can't find in rural Kansas, end up staying here. So the impact is, it's kind of hard to, like Chad said, it's kind of hard to measure because so many of them become homeless. But this will have a big impact on a lot of Kansas, especially central and western Kansas.
Thank you.
And the homeless people that we serve, we use a local zip code, so it's really hard to track.
Yeah.
Other questions or comments? Well, thank you, and thanks for getting on early. You do a great job, and even if there's, as Jen cited, that one person, if we can save one person's life, that's pretty pretty big deal. So thank you, and look forward to working with you in the future.
Thanks
Yes.
for having us.
Thanks for having us.
With that, I don't have anything else for the board. The next meeting is scheduled for March 14th. And we'll get out a agenda early for that. Again, appreciate everybody getting out in the cold that got out and those that joined us via WebEx. And with no further business at hand, I will call this meeting to a close or adjourn it or whatever officially happens. Thank you.